DJ is coming to us from Sacramento, where he's helping with the COVID crisis for Governor Newsom. DJ held many roles in academia, industry, and government. He's best known to be President Obama's first data scientist. And in that regard, he's worked intimately on much of the data that Vanita spoke about as well, in mining it and explaining it and surfacing it and so forth. And as management guru Peter Drucker famously said, you can't manage what you can't measure. So here is Mr. Data himself, DJ Patil. DJ?
Yeah, thank you for having me. And it's great to see so many great people. There's a lot of people here on this call that I haven't had a chance to connect with in far too long. Nick, Monica, Deepa, Manu, Deep Nishar. I mean, good to see all of you. I also want to thank Reverend for all his work that he's doing at the local community level and so much of the leadership that's required to help just constantly be that force pushing the community to be better, especially through very strong brokered relationships. And I also want to thank Vanita, who is a hero of mine, and we got a chance to work together, unfortunately only on really bad problems during the Obama administration, and it's taught me so much working on these issues. You know, when I first started working on these problems, the thing I would tell you is this wasn't the set of problems I necessarily expected to find myself working on. What I think became clear in the White House while working on problems that you see have the greatest impact on society is you find these places where you can't just fundamentally believe that this is happening because you think that the world operates a different way. And some of the things that changed my opinion more than anything else was just spending time in those communities. You know, being able to spend time with those that have been incarcerated, and particularly our endless cycle of incarceration in our local jails, but also being able to really spend time with people in different communities trying to make change, positive change, much like the Reverend is. And so let me take just a few minutes and kind of walk around some of the problems I see. As you can see, I'm in my extraordinarily glamorous filing cabinet office here at the State Emergency Operations Command Center, where we run both the COVID response for the state, but also the coordination efforts for law enforcement. And so I'm dual-hatted at the moment working on these. I've been here nearly about 13 weeks. And what happened was we just showed up. We said, you don't have necessarily the right people. And so a small team of us just packed up and said, we'll be there on Monday. And we just said, we're unpaid volunteers and we're just here to help, and just give us a badge and we're here to help. And since then, we have increasingly led large portions of the state response. And the thing that I think is particularly challenging right now, especially if you look at through the lens of COVID, is what does healthcare look like for society? What does Maslow's hierarchy fundamentally look like? Food, clothing, water, shelter. You know, one of the things that's there is right now, it looks apparently from the limited data sets that we have, Blacks in the United States die at 2 times the rate due to COVID than anybody else does. And I think those numbers are significantly undercounted. And so COVID is a disease that is ravaging the underserved population substantially more than anyone else is seeing. The hospital systems that Blacks get access to are oftentimes the county systems. Those systems is not about bed capacity. It's about the amount of personnel that are there to support you. And so as a hospital starts to fill up, there's no more resources and your quality of care is going to dramatically drop. And that is already on a substantially lower quality of care model than is already there. And there's all the classic healthcare data that we know about how the Black population has not received healthcare. And by the way, this is historic. It's for those that are unaware, that for a long time, there was no healthcare system for Blacks. And the reason that changed is fundamentally because the federal government, through the Health and Human Services, largely through the Centers for Medicare and Medicaid Services, enforced a rule that said if you want federal dollars, you have to have an integrated, you can't treat people differently. And so that is what's fundamentally changed, but we've still are digging out of ensuring that our hospital systems actually work. And you want to see racism and sexism in its most raw form, look at our healthcare system. If you think about the way we test for drugs, look at our clinical trials. Who are our clinical trials for? Most of the time, if you find who's in the data sets, it's middle-aged white men. Why? Because who advocates when somebody has a medical problem? It's oftentimes the spouse, the female spouse. And they're oftentimes the people who live near large academic research institutions, like in the Bay Area near Stanford or UCSF or other places. And so you don't even see women in the data sets because they don't advocate for themselves. And certainly you definitely don't see Blacks or any other minorities. You don't see Asians of any kind. And so what I'm worried about with COVID fundamentally is an accelerant of unemployment. We're already seeing the food lines increase. One of my first duties here was to figure out how are we going to secure the food pantries? Where are we going to put the National Guard? Because we're expecting large lines. And you're seeing the images of these incredible lines that are coming. And by the way, this is just the beginning. If you think about the unemployment numbers that are coming, we're at the early phase of this. Second part of this that what we're worried about here is if you think about COVID, it's kind of the semblance. We told everyone to stay home. A lot of people don't have jobs, and we said wear masks. And so if we think about the potential for unrest, it's a powder keg. Now, we can easily blame COVID. We can blame the fact that we have so a few bad actors, but it's not addressing the systemic issues. And what I worry about is that COVID is about to become this accelerant that separates society again in this fundamental way. When we look at the budget cuts that are about to happen at the state and county levels, everyone's worried about COVID. We are about to implement a generational divide because all the social services are about to get decimated. Those programs that break, the pipeline of ending up in prison, the preschool to prison pipeline, those programs are all going to get eradicated because there's no money. The state budgets are gone, the county budgets are gone, and they are the first things to go. And people are not talking about those budgetary aspects. And that is going to foster a downward spiral rather than help pull people out. And I think we have to all ask ourselves, how are we going to fill that gap? Because that's going to just set us back as a society, not just one group. It sets us back as an overall group. One of the things with direct COVID in jails, there's this idea called R0 that you may have heard about the infectivity rate of COVID. If one person has COVID, typically they infect 2.3 people on average. The R0 in jails, which has not been really discussed, is oftentimes somewhere in between 9 and 15. It means one person infects 9 people to 15. We have the cycle of jail where people are just cycling in and out, and especially the places that haven't done what's called decompression, those people are getting back out in the community and they are infecting a lot more people. And so we're not actually finding a way to address this. And so let me just, because I think it's actually one of the most important things is how do we find dialogue? Because, and what the Reverend's talked about, what Vinny has talked about the things that have been implemented, a lot of these ideas are not new. We've been talking about this stuff forever. And one of the things I even talk about with COVID is who controls the real response for you on COVID? It's not the federal government. It's not the governor. It's a combination of your mayor and your city council members and your county supervisors. How many of you know who your county supervisor is? How many of you care what the approach is of what they take? And these roles are so critical from healthcare policy to the way we think about enforcement, our policing strategy, our over-policing strategy in many cases. All of it is tied to that layer, and how do we educate our groups to vote? And so part of this is showing up. And that's a thematic aspect I think you've heard. We have to show up. And it's kudos to all. Thank you for all of you showing up tonight. Second is we all have to use our voice. We all have platforms. We have to speak out. And then we have to push ourselves to be better to each other. And I can't tell you how many times I worked when I was working on policing issues and criminal justice reform in the White House, that when I came back home and I was at one of our classic kind of family functions or a wedding or anything, with many of the people who've been on these calls, like with other friends that we all know, who said something like akin to, well, why would you do that? That like they brought it upon themselves. This innocuous, this is insidious racism at its core. It is the dust. It is what's in the air, and it exists in our community too. And I apologize if that's a hard message to hear, but it's an important one. That if we can't look in the mirror and ask ourselves about what we think is the world we want our kids to grow up in, and are we part of that? Are we standing up? Are we advocates? Are we looking out for the people that we talk about? Are we really, really holding hands with each other? Are we really calling each other brother and sisters? Because that's not the way I would treat my brother and sister. That we need to start with that change ourselves. And when our community doesn't hold itself accountable, we are complicit. And that is something that we equally need to do as part of not only showing up, but speaking out. And I'm looking forward to the dialogue, because I think this isn't just one time. This is going to something that we need to work on throughout the conversation that needs to take place. And this isn't going to be solved in just a few months, but we got to stay on this. So thank you for the opportunity.